Taking this medication has allowed us to assess the quality of life. The quality of life has undoubtedly improved. In fact, all the patients I prescribed it to.
Hello dear viewers, we are on the Synthesit channel. My name is Alexander, and on this channel people who take the bioactive mineral share their results. And today we have a doctor as our guest who has personal experience taking Synthesit as well as experience prescribing it to people, to her patients. Elena Sergeyevna, hello again. Please introduce yourself. Fully, tell us your name, what city you live and work in, what your profession is, and where you work.
Hello dear friends, my name is Golesheva Elena Sergeyevna. I live in the city of Rostov-on-Don. I work at the company Lemma Center. I am general practitioner. I have been conducting bioresonance testing for many years, and also a nutritionist.
All right. Elena Sergeyevna, you have your own experience taking Synthesit. We'll talk about this later. And you have already gained quite an impressive experience in prescribing Synthesit to your clients. Accordingly, there are certain results, and we know that one of the main properties of Synthesit is its work with blood. So this is about restoring the fluidity of the blood through oxygen saturation. So, please tell our viewers, to start with, what oxygen means for our body.
As a doctor, how do you see this? What does modern science say? Any of our organs can only function. Let's say if there is enough oxygen. In other words, all oxidative reduction reactions in the body occur only with the involvement of oxygen. There is not enough oxygen. Accordingly, early apoptosis begins, meaning the aging of cells, cell death, and as a consequence, this happens very often. In conditions of hypoxia, a tumor process develops because tumors grow where there is no oxygen. So, when this medication came to us, to our organization, I paid attention to it, watched a lot of videos, and it inspired me. I decided to use it in my practice. Well, as a rule, you always start with yourself. And then I began to prescribe it to my patients. When it works, first of all, these are patients with cardiovascular diseases because mainly it is precisely with insufficient blood circulation, disruption of blood flow, and heart function that these issues manifest. Weakness, fatigue, impaired motor activity, swelling, and so on. But I can say that many diseases are accompanied by very similar symptoms. So for those patients of mine to whom I used this medication, in terms of treatment, I saw very good results. Improvement of the clinical picture. So first and foremost, it's about restoring strength. That is, people became more capable of working. The clinical symptoms, many diseases were disappearing. I was also very pleased with the positive changes in thyroid gland diseases, especially in people who have autoimmune thyroiditis, hypothyroidism. It is alongside the usual therapy. The introduction of this medication yielded quite good results in terms of normalizing biochemical indicators. On one hand, on the other hand, the overall well-being has significantly improved. I don't have a single patient who hasn't shown improvement after being prescribed this medication. I used various dosages depending on the condition. The average dosage, as recommended, is 1 capsule per 60 kilograms of body weight. I changed dose. I was basically adjusting it for them. And so for some I prescribed 1, for others 1.5, and sometimes even 1.25, depending on the results I was seeing. All right.
Elena Sergeyevna, can I ask a question? You already have quite a long experience in prescribing Synthesit. Accordingly, there are results. Could you please tell me what changes? You can observe in the same area, for example, you mentioned biochemistry. So using some hardware diagnostic methods, what do you see changing in people when they start using Synthesit?
The purpose of the iron Synthesit, well, first of all, the lipid profile improves. That is, the cholesterol levels, the levels of all cholesterol fractions, the atherogenic index decreases, and the results are really very good. I have one patient who was taking statins, but that's a medication that lowers cholesterol levels. Then, since she had been taking it for quite a long time, there were some side effects, and I suggested she switch this medication to iron Synthesit. And so she took it for 3 months, completing 3 courses of 20 days each with a 10-day break. And after 3 months, she retested, and the results were very good. Moreover, we completely stopped the statins before prescribing this medication, because the result is good. It was very good. What else?
Can I clarify about that patient who was on statins? So, did you switch from statins to Synthesit all at once, or did you gradually reduce the statins while using Synthesit?
No, I recommended stopping the statins immediately and switching to Synthesit, accordingly with the dosage that we selected.
And how did you determine the dosage?
I conduct bioresonance testing. I have the ability to determine the dosage in the form of an examination, so I can individually determine the dose that is just right for each person. 60 capsules for 60 kilo of weight. It's like combined, right? I can just determine the exact dosage. So I have that opportunity.
Yes, dear viewers, we repeatedly mentioned that the dosage of Synthesit is 60 kilolo. One capsule is the average dosage. And as a result of your personal experience with Synthesit, of course, you should develop your own dosage. It can be less or it can be more. And in Rostov-on-Don, there is the Lemma Center, an organization with a wonderful device for bioresonance analysis, or how it will change. And earlier, bioresonance testing was used, through which specialists can determine right dose of Synthesize. The one that will be suitable specifically for you. And I understand that this applies not only to Synthesize, but also to other medications. So good. And by the way, dear viewers, regarding cholesterol, what we've just heard about the results in lowering cholesterol levels, as well as alanine aminotransferase and aspartate aminotransferase, which we see in people, we obtained these results from the first groups of individuals, those who started taking Synthesize, back in late 2019. At the beginning of 2021, and later in 2021, we specifically conducted a study, a preclinical study at the Research Institute of Medical Primatology on monkeys, on rhesus macaques, where it was also confirmed that taking Synthesize for 30 days or 40 days, the monkeys were taking Synthesize, receiving Synthesize, their cholesterol, ALT, AST, sugar levels also decreased. And we have some formal evidence of the effects of Synthesize. Again, yes, if you have elevated cholesterol levels and you are taking some other medications, if Synthesize is not your medication of choice, then you should definitely consult with your treating specialist. Should you stop taking statins right away, or should you gradually stop taking them? Implementing Synthesize, that's more of a question for your treating doctor or the specialist you work with, you consult with. Okay, but are there any results regarding blood pressure? Many people suffer from this condition.
Regarding blood pressure, there are some sensitive data indicating that the pressure has normalized. Let's say it's stable, but I don't have that yet because, well, it's a rather, how should I put it, lengthy process. That is, patients take blood pressure medications for a long time. Many factors influence the increase in blood pressure. So a person can have normal blood pressure. He might get nervous, and as a result, his blood pressure can rise. So here, I didn't set myself the task of specifically tracking the numbers of blood pressure, but what's characteristic is that the main goal of our treatment is to restore a person's ability to work, to give them the opportunity to live normally, so that there are no complaints, so that he isn't troubled by shortness of breath, swelling, palpitations, and so on. So the person felt good. And so taking this medication allowed us to assess the quality life. So the quality of life has undoubtedly improved. Well, actually, in all the patients that I was assigned, as for the indicators, I'm still continuing to monitor them. For now, I'm basically watching, monitoring how does the condition change? Because many diseases are chronic. And let's say a person needs to take it for some time, 3 to 4 to 5 months, to see what the result is. And what do you understand? The end result. But the fact that the improvement is obvious, without words, without comments, as they say.
But I mean, it's about the moment of taking it. So when a person starts taking it, you see that their blood pressure tends to normalize. You just need a longer period to understand that the problem has already gone away.
Am I correct in understanding that you realize that arterial hypertension, that is just elevated blood pressure, is a symptom complex that follows this? The tail, so to speak. What are we always afraid of with arterial hypertension? High blood pressure that the blood vessels can't withstand, meaning a hemorrhage. These are stroke, heart attack, and so on. The prescription of this medication primarily improves the rheological properties of the blood, meaning the blood becomes more fluid. It's not as thick and the risk of thrombosis decreases, So these risk factors that accompany arterial hypertension go away. And it's a big plus. And this gives us the opportunity to improve both the quality of life and the patient's lifespan. Well, regarding the numbers, blood pressure, well, for now, I'm still observing patients. I'm watching the dynamics. As soon as I have, well, let's say more accumulated data, I will definitely share it with you. Then with the results.
Okay, yes, we just have such cases. When, for example, young people and older individuals get results from correcting their blood pressure using a synthetic drug, they stop taking it. Mineral thinking that the problem is solved. But, dear viewers, if you already have arterial hypertension, then it's a complex of problems that cause it. It's not just about the fluidity of the blood. Yes, so this is also a number of other functional disorders that lead to this. The condition here right now leads to, we need to take a comprehensive approach to the body. You always need to take a comprehensive approach and address the issue comprehensively. Of course, we shouldn't limit ourselves to just one specific medication. It could be a synthetic drug or it could be other medications. It should be a specific diet and physical activity.
The situation for the doctor was that the doctor should manage such patients because they can't do it on their own. As a doctor, I absolutely do not recommend stopping medications on your own. So this is only together with a doctor, hand in hand, so that the doctor can support you, advise you, recommend how to behave in one situation or another. When you prescribe iron synthesis, we understand clearly that the first capsule, no medication works right away. It takes time for that. You need to tell the patient what they might expect, the specifics and so on. It all has to be together. It has to be with a doctor. That's essential. So people who take it on their own, that's more of a preventive measure. If a person has problems, it's better. A doctor should support, help. A doctor understand the problem, personal involvement matters. A doctor should support and help.
Well, yes, first of all, a doctor. And secondly, you need to understand the problem yourself, because your personal involvement is also important. A person should know what they have and how it is and consider different options. Because a doctor can think a little bit from the perspective of the person. There are also other doctors, other practices. There is traditional and alternative medicine.
There are those who understand what this medication is and its features.
Well, about the Synthesize. I see, yes. By the way, dear viewers, the new packaging of the Synthesize looks like this now. So, we removed the word iron because even Elena Sergeyevna, when talking about Synthesit, says iron Synthesit because it says iron Synthesit here. So, we removed it. Yes, because Synthesit is something more than just iron. This is a unique product that has no analogs in its action. In terms of speed of action, the number of effects it has, as well as its safety. All right. Elena Sergeyevna, are there any other interesting cases? Do you have any cases that would be interesting to share with our viewers about your patients?
Well, I can say that the medication acts very quickly in acute problems, acute, let's say, respiratory illnesses. So, increasing the dosage of the medication to about 4 capsules leads to recovery in just 2 days. I believe that this is a very good result. Here, then, again, regarding hypertension, you mentioned blood pressure. In a hypertensive crisis, there is a concept called post-hypertensive state. When a person is broken, weak, they can't get up, dizziness. Again, if this is taken against the background, that is, if this happens while taking Synthesit, then, accordingly, it proceeds in a completely different way. This complication, it can't even be called a complication. So a person comes out of this state significantly easier. I have a patient, she came to see me and her blood pressure was 230/130. Well, to be honest, it doesn't happen that often, but such high blood pressure during an appointment, so I gave her a quick relief pill, but I gave it at the same time. And here is Synthesit. Well, I actually want to say that she came out of this state quite quickly and more easily and smoothly.
That's why. So, has anything interesting happened with any specific organs in people? Digestion. I don't know. Can I come up with something for you?
I can sense of smell. You reminded me well about vision. Vision improves quite well, especially for younger people and those who have to spend a long time in front of a computer. Right now, many people work on computers and notice a decline in their vision. So even 1 or 2 courses of this Synthesit, patients note that their vision has started to recover, that they manage without glasses and their eyes get less tired. In this regard, the results are very good. I can't say that I have a lot of such patients right now, but I've already observed about 5 or 6. I can say that I too because I work a lot on the computer. And when I took the medication during the first course, I didn't really notice anything special. But after the second course, I noticed that what I used to read with glasses, I can now see without them. A good result. What do you associate that with? With nutrition for the eyes, I associate it with the improvement, microcirculation. The main function of this medication is to improve microcirculation. It's the enrichment of cells with oxygen. Cells work when a sufficient amount of oxygen is delivered. So the exchange in chemical processes, it's happening at the proper level. So all the oxidative reactions are happening at that level, that they are laid down. And actually, why do blood parameters normalize? Why do the internal organs recover? Because the organs start functioning at the level, let's say, of a young organ, because a sufficient amount of oxygen is delivered. Nothing interferes with the organ's functioning. That's why recovery is happening. Yes, iron synthesizes. You see, it's a bit of a name that confuses people because iron is present. This is only with the first iron, so that's how it is now, yes. There are 0.800 micrograms of iron there. Considering that regular iron is 50 milligrams, just imagine how little iron there actually is. I explain to my patients that it's not about the iron, but about the fact that your cells are getting oxygen. The cells are being saturated with oxygen, and all processes in the body are being restored. Recovery is happening, meaning there's stimulation of stem cells. The recovery of those, let's say, pathological processes that were taking place is happening. They go away and normal biochemical processes are restored in each organ. So this is not just about one organ. It concerns the body as a whole. These are the blood vessels, but the vessels are all organs. You see, how can I put it to you? The main thing is that it improves microcirculation. It's whole body. These are the blood vessels of the head. These are the blood vessels of the legs, the blood vessels of the liver, the blood vessels of the lungs, the heart. It's blood vessels everywhere. So recovery, meaning the influx of the right amount of oxygen to the cells provides this rejuvenating, restorative effect.
Well, yes. Dear viewers, here are the vessels, capillaries, and teeth. Even in the teeth there are capillaries, which not many people know about. But there is a certain network that supplies it. They're everywhere. Capillaries everywhere. In the bones. Just look it up on Google. Bones and capillaries. Fingers. Nails are nourished. The nail matrix has capillaries. A lot. Synthesit restores circulation. The same goes for nails. They start to grow normally. They become flexible and strong, and they stop breaking. They are being implemented. The ridges go away, and even on the nails, the hair stops falling out, but this happens very, very quickly. And I would like to draw your attention to this, dear viewers. So, as I mentioned at the very beginning of the broadcast, this is the main property of Synthesit. Yes, it's about restoring blood flow and saturating the blood with oxygen. But we also remember that in synthesis, it also has an anti-inflammatory effect. There is a synthesis called the effect, which has been proven in vitro. This involves working with enzymes. The activity of such enzymes as adenosine, deaminase, and K-synthetin oxidase. These are enzymes of pathological processes that increase in various diseases. Synthesit reduces their activity. And all of this, of course, contributes to the protection of the cell, including the protection of the vessels. And here I would like to address an interesting question. We have a lot of results from the combined use of Synthesit with chemotherapy or radiation therapy. When side effects from chemotherapy is practically nullified because Synthesit acts as a certain protector. How do you see the possibility of using such Synthesit?
I believe that this drug has a great future and very big prospects in this regard, because the main problem with chemotherapy is the suppression of the function of normal healthy cells, meaning that a healthy cell is actually being inhibited. It's suppressed. You mentioned the immune system, but when does the immune system actually work well? It works well then when all, let's say, the components have the opportunity to engage in reactions. Let's put it this way, that's correct. And when this process is disrupted, the production of the same cells, macrophages, leukocytes, lymphocytes, and blood elements, is also affected. And accordingly, the immune system suffers in this situation. And in oncology, I already mentioned that in conditions of hypoxia, meaning when there isn't enough oxygen enters the cell, all conditions are created for the development of a cancerous tumor. And accordingly, the production of those enzymes you mentioned increases. So, as soon as a sufficient amount of oxygen enters, the conditions of hypoxia disappear, and accordingly, the production of these enzymes decreases and completely disappears. So the cell starts to function normally. As for chemotherapy, under the influence of chemotherapy, there is this oxygen starvation. IT in the mouth is increasing. And at the same time, the introduction of Synthesit allows the cell to resist the toxic effects of chemotherapy drugs or radiation. Who is receiving what kind of treatment? So, here, we are not only slowing down the growth of the tumor cell itself and its metastasis, but on the other hand, we are also mitigating the toxic effects. Chemotherapy and radiation therapy, which very often leads to, it's not even so much the tumor itself. For example, a person is operated on, the tumor is removed, but then chemotherapy and radiation therapy are conducted. And under the influence of these negative factors, the body's functioning is so disrupted. So in fact, there is toxic damage to all organ systems, and a person often dies not because of the tumor itself, but due to the toxic effects. This aggressive treatment, so I say, again, there is a great future ahead. I think so. What scientists need to pay attention to this. It's special, because it's a unique drug.
Yes, in this regard, Synthesit has no analogs. Honestly, I tried reaching out to various private centers that deal with cancer treatment using chemotherapy and other methods, but as a rule, there are no reactions. So, apparently it hasn't reached the right people yet. But dear viewers, I want to say that if Synthesit, it helps the body protect itself from such powerful, harsh impacts as chemotherapy. So, accordingly, factors like poor ecology, some toxins from production, and harmful substances that come with food, Synthesit helps the body protect itself from those as well, especially if it helps with something from chemotherapy. It's very important to understand this. So, this is a very powerful medication that is not only for wrestling, mixed martial arts, it should be used for certain ailments. But, first of all, for prevention, especially where it's needed, where there are high loads. So, this is sports because Synthesize increases endurance. So this is some kind of chemical production. These are programmers. Look, their eyes get red by the end of work or in the middle of it. God forbid, if vision decreases, please, there's Synthesize. Clarity, brightness, the images improve, and the brain works faster. This is an increase in productivity. What about all programmers? This is the hour in which you need to get the work done. If you do your work faster, it means you can do more work and earn more money. This applies to a pretty large number of professions, especially those who work online. Well, good. And let's probably move on to your personal example now like this. Finally, we've saved the sweetest for last. Share your Synthesize experience. How has it helped you? And we'll start wrapping things up slowly.
Well, I started taking it at first just out of curiosity, to be honest, because when they introduced it, it was presented in a very interesting way. I think I'll give it a try. Well, first I took it for literally about 5 days, and here. I was talking about the illness. I later prescribed it to my patients, but the first patient I tried it on was me personally. So I caught a cold with a high fever. I was feeling terrible, and I basically decided to take the medication just as you recommended, two times. And how surprised I was when in the evening, I had a temperature of 39, I took 2 capsules. In the morning, I woke up, the temperature was still there, so I took 2 more capsules. Before lunch, my well-being was kind of unclear, but the most interesting part is after lunch. You know, it's really interesting, like by the wave of a magic wand, I started feeling better and better. I even thought maybe I shouldn't take Synthesize a second time. I think, no, I'll take it again. I took it again in the evening, and the next day, when I woke up in the morning, you know, when you have such a temperature, there's still weakness, fatigue, malaise. For a few days afterward, well, in general, a bunch of accompanying symptoms. The most interesting thing is I woke up practically in the evening, and the next day I woke up a healthy person. I said I was so surprised and pleasantly amazed by this. So basically, I decided not to take it in the evening, and, well, nothing happened. I didn't feel anything. It was so good, and it stayed that way. I took 2 capsules, continued for 20 days, paused for 10. So I usually take it, niece, for 20 days, drink for 10 days, and then take a break. Doing about 3 courses. By the way, for the 3rd course, I started taking it a little less often. Well, because I was feeling really good, but after the third course, I can say that I had serious problems with my blood vessels. I even had to undergo surgery. And when I started taking this medication, I had some unpleasant symptoms. I understood that I needed to go back to the eye doctors. What makes me happy right now is that I don't have to go to them. All my symptoms disappeared. And in that regard, everything is very good. Not only that, the sensations, but who has taken the medication? Maybe I'll be understood. It feels like, just like in my youth, nothing hurts. Well, in general, from the word absolutely nothing. So just a good feeling, no headaches, no weakness. And I had another symptom. So before, if I tried to just sit and then suddenly stand up, I definitely had to stand still for a moment, hold on to something, because it would get to the point where I felt almost faint. Well, I mean, blood, unfortunately, it didn't fully compensate for the needs of the brain. So after the second course of taking Synthesize, I discovered this completely by accident. I suddenly needed to stand up and run, so I stood up quickly and ran. And only when I was already there, having done something, did I remember that I just ran. There were no fainting spells at all. And everything is just like always. And right now, it's really good. Also, what's good? You know, the noise in my head significantly decreases, but especially older people, this is a fairly common symptom. The noise in the head, if it doesn't interfere, let's say, with the overall well-being, is still annoying. Very annoying. For some, hearing decreases. I also experience this symptom, and I can say that it hasn't completely disappeared yet, but it has decreased several times, which makes me very happy. So, that's really good. It's really good. I want to pause. It's not really about myself, but I had one patient with a stomach condition. This is gastroduodenitis, a rare flare-up, which is inflammation of the stomach and the duodenum. And so, against the background, let's say, after taking Synthesize, my condition just has really normalized. And this is without the medications that I usually prescribe, without gastroprotectors. And it's been quite a while. Let's say, despite the fact that I'm watching, the person has started to break the diet and lead their usual lifestyle. But thank God there are no complaints so far. So the medication is working. It's nothing to be scared of. It works really well.
Well, yes, this is, of course, dear viewer, if you had any kind of illness and something helped you, like Lena Sergeyevna said, you started breaking the diet. Don't rush to start breaking the diet as quickly as possible. First of all, make sure that you have fully recovered. So this is very, very important. Well, periodically, of course, take Synthesize to maintain this condition.
Well, what else can I say? You know, I still recommend taking it not just occasionally, even though its cost is certainly not cheap. But you know, feeling great, feeling normal, in the absence of many problems. I think it's a fee, quite small, even though it seems like it's not cheap. And then if a person has completed at least these three main courses, supportive therapy, at least 3 times a week. Well, many of my patients are taking it 3 times a week now, and their well-being, basically it's maintained at a false level. So it's not that expensive. Who seems, well, great, I agree. Yes, considering how much the health condition improves.
Yes, there is. We have many consumers of Synthesize who compare Synthesize with the active ingredients. It says that the cost of the medication is generally from 30 to 200,000 rubles. So, well, there are different variations, you know, because it affects the body, that you can give up many other medications, dietary supplements, and so on. Yes, that's actually true. By the way, just now, the director of the center, Lilia, I saw her peek into the frame. She sent me material where they talked about retinal detachment and how Synthesize helped to correct the condition. Can I also share some information for the viewers?
Well, retinal detachment. This is a quite serious problem, and as a rule, it is treated surgically. But if the detachment has already occurred as such, of course, it still needs to be treated surgically. But the initial signs of detachment, with the help of this Synthesize, we managed to stop it. Yes, that's right. Indeed, that case happened. How quickly I just want to say that I fully recovered in approximately about 10-15 days.
And was this confirmed by equipment?
First of all, you understand that when the detachment starts, there are characteristic symptoms. These symptoms started to go away very quickly. Everything recovered, and accordingly, the complaints completely disappeared. And the condition upon examination, of course, normalized.
Okay, I got it. Very interesting material. I hope that in the future everything will be fine and that this problem won't happen to the person again.
Especially in terms of treating patients with cancer, I still want to use this medication because many patients I talk to, for example, those with serious illnesses don't need to undergo chemotherapy. I'm very glad you came. I can't do it yet. I'm prescribing these medications, but it's all still in the monitoring stage. As soon as I have some results, I'll share them. Okay.
Yes, let's gather more material for now, as they say, to make it more polished, dear viewers. If you are in Rostov or the Rostov region, here is the Lemma Center. Please contact Kalenia Sergeyevna. If you are planning to take Synthesit, or even if you're not, the bioresonance method is definitely relevant. These are all practical aspects. So, you can find out your dosage to avoid experimenting. Just a quick minute to promote your center. Thank you very much. Thank you for your comment, Elena Sergeyevna. It was very informative and useful. I think, dear viewers, if you also liked this video and learned something new about maybe health or about Synthesit, how to use it, of course, share it with your friends and give it a thumbs up. I wish you all good health. All the best. Goodbye. All the best.
Stay healthy.
Yes, be healthy.